always tired? Do you suffer from chronic fatigue? Maybe you're wondering if your fatigue is normal, or maybe you've been diagnosed with a chronic disease that is associated with fatigue. Either way, I can assure you that your fatigue is not normal and is a clue that your body needs help. If you have already visited your doctor and been told there is nothing he can do, you may have a hard time believing this, but there is a solution to your problem. Your doctor will probably rule out some of the more well-known causes of fatigue, such as iron deficiency anemia, depression, sleep disorder, thyroid disorder, or high or low blood sugars. He or she may even look into some of the chronic diseases that can cause fatigue, such as liver or kidney disease, heart disease, fibromyalgia, rheumatoid arthritis, multiple sclerosis, or lupus. However, there are numerous causes that doctors often overlook. It could be a chronic virus, such as Epstein-Barr virus, or what doctors are now calling long COVID or long haul COVID, which is a complication of COVID-19. A common cause of chronic fatigue is Lyme disease. Stress and adrenal fatigue can also cause fatigue due to persistently elevated cortisol levels. It could also be a hormone imbalance, or a food sensitivity, or a vitamin or mineral deficiency. It could even be caused by a medication side effect. Common medications that cause fatigue include antihistamines, blood pressure medications, antidepressants, anti-nausea medications, seizure meds, and steroids. Other common causes of fatigue include toxins, heavy metal toxicity, dehydration, and liver congestion. So, in conventional medicine, the first step is to try to find the cause of your fatigue. However, fatigue can be a symptom of any disease, so it is difficult to narrow it down and find a cause with traditional testing. Unless you are diagnosed with a chronic disease such as fibromyalgia or rheumatoid arthritis, then the doctor is unlikely to find anything. They will treat the symptoms of your chronic disease, but oftentimes the root cause of the chronic disease is not found or treated. And there really is no treatment or magic pill to make fatigue go away. In functional and alternative medicine, we are also interested in finding the cause of the fatigue. A careful medical history is usually our first step. Lab testing can also be helpful. The most useful tool in this situation is muscle response testing or quantum nutrition testing. With muscle testing, we are able to find imbalances in the organ of your body that may be contributing to the fatigue. Once we have found these imbalances, we are able to test you for specific supplements and correct these imbalances. There are also some practical things you can do to combat fatigue. The first is to drink plenty of filtered water. Water hydrates the cells, flushes out toxins, and performs many functions to keep us healthy. It is also helpful to eat foods with plenty of nutritional value and limit the amount of refined carbohydrates and sugars, because these can contribute to fatigue. Another activity that can help with fatigue is exercise. Although exercise may make you more tired in the moment, people find that as they incorporate regular exercise into their routine, they begin to have more energy. It is also important to get enough sleep each night. Most people need between 7 and 9 hours, and children and teenagers need more. If you have trouble falling asleep or staying asleep, visit your practitioner to find the cause. It is helpful to learn to manage the stress in your life effectively. If you want tips on this, check out my video, Is Stress Affecting Your Health? I hope you can find the underlying cause of your fatigue so that you can be full of energy to live your life and fulfill your purpose.